Hi, welcome to this presentation on topical oil application. I'm really excited to be bringing this information to you because when I first learned it, I was blown away and I realized that a lot of the reason why I wasn't getting perceivable results from oils or these really drastic results from oils is because when you instinctively just put the oils on and you don't have the information that I'm going to present to you in this class, you're not going to get a really effective application of the oils or a significant amount absorbed and bioavailable in the body. And so let's just take a little journey back through pharmacokinetics because this is the study of how essential oils are really absorbed into the body, and then it follows the pathway all the way through to how they're excreted out of it. And so there really are only a few ways that oils can go into the body, and that can be by definition intravenous, which is 100% absorption into the bloodstream. This is not something that is used or approved in any fields or branch or nation that has an aromatherapy tradition. Then you have an oral ingestion, which there is usually about a 95% absorption into the bloodstream. Inhalation, where I actually was just talking to a lead scientist yesterday who specializes in pharmacokinetics, and he was saying that really these numbers are very conservative, that with inhalation you might be getting closer from 70 to 80, but I left these numbers in this recording because this is the published literature. And really, these two numbers go nicely together. A great way to think about it is that with inhalation, you're going to get about a 50% of the absorption of the oils that you inhale. So when we say inhalation, this is absorbing the percentage that you inhale, not the percentage of what you diffuse into the whole room. So this is obviously very affected by whether or not you have a direct inhalation or a whole room diffusion. But you absorb about 50% and then you can think and you absorb about 5% topically. That's a huge difference in the absorption between topical and inhalation and oral. And really, the number is probably closer to 80% with absorption into the bloodstream, according to this scientist that I was just talking about, who formulates all of these amazing blends and just is such an expert on pharmacokinetics and bioavailability of essential oils. So it was an amazing time. And she's actually studying to become a doula. So she was really excited to share. We just had a long, amazing conversation about just the dosage recommendations that were in this course. And it was a fun time of connection. But so then with topical, really, this number can be closer to 1%. And we're going to be talking about the different things that you can do with topical that will really bring your absorption rate um, honestly close to zero, down to really 1%. And so this is really important information because people instinctively just love the oils and they instinctively start to lather themselves and to put the oils on their body. And many trained aromatherapists mostly do inhalation. And that was really a distinction that I began to see and thought, I wonder why that is. It seems like the more education you have, the more you go towards inhalation and an oral ingestion. And so I'm going to share with you the insider information so that you can make informed choices with your oil use and really each of these but there are times when you would absolutely want to use a topical application, and so it's just important to know that essential oil constituents can be absorbed by these routes by each method of application. Each has its own physiological process, its advantages and its disadvantages. Now in this course we only teach a topical application and a direct inhalation method utilizing personal diffusion. So we don't teach the other ones in this course that's specifically for labor and delivery. So looking at the pharmacokinetics of transdermal absorption, we are going to look at the dermal structure and permeability of the skin, particularly the stratumum corneum and the intercellular lipid matrix, to understand how oils get into the body. We're going to talk about ideal body locations to apply the oil, the why and the how of dilution, and basic information on bioavailability that we're going to dive into more later. So really my goal for you in this presentation is just to understand, how does it work? How does transdermal absorption work? How do I do it safely and effectively? Where, when, and how should I apply the oils topically? How much of the oils reach the bloodstream? How fast do they get there? And how long do they stay? Well, let's start with the basics. There's two openings in the skin: sweat glands and hair follicles. The primary way, though, that oils enter our skin is directly between the cells of the stratum corneum through the lipid matrix. People will often say that essential oils are absorbed through the pores of the skin, although they don't really specify any farther from that exactly what a pore is. There are two types of opening in the skin: sweat glands and hair follicles. Sweat glands don't allow for much absorption of essential oils because the water-based sweat within the gland repels the oils. Hair follicles allow for a lot more absorption than sweat glands, and that's because they have a sebum-lined hair follicle that is oil-based. But really the important thing for you to understand is that pores is not a scientifically correct way of speaking about how oils enter the body. And it's important to know that because a lot of people are confused about what areas of the body are good to put oils on. And when you understand how they enter the body, it is obvious to you where you should put the oils. So if you understand that hair follicles allow for more absorption than sweat glands, and that sweat glands actually repel oil absorption, and you understand that the main way that oils go through the skin is directly through the lipid matrix, it's intercellular, then it makes more sense where you would put the oils. But let's talk for a minute about what happens after the oils go through that first layer of the stratum corneum, or if they enter the body through the hair follicles. The constituents at that point are going to pass into the epidermis and then the dermis, and then they're absorbed into the capillary circulation of the body at the level of the dermis. And because essential oils are an oil, they are lipid soluble, many are retained by lipid rich areas of the body. So many constituent molecules are retained in the outer layers of the epidermis and in the subcutaneous fat right under the skin, which does have a poor blood supply. And so a lot of these retained constituents, they don't go down to the adjacent levels. So the level of subcutaneous fat that is in a particular area of the body, such as, um, the abdomen when you're not pregnant, um, and just other areas where you're like, yeah, I have some fat under that skin. That's not going to be a place to apply oils where if you're really wanting those oils to get into your bloodstream. But we're going to talk about why you would essentially, if you want an oil to be in your bloodstream, a topical application is not your application of choice. But just so you know, absorption rates are affected topically by the level of subcutaneous fat, and that's because oils love to stay in oily areas. So if you have a lipid, rich area, they're going to stay there. Now, one thing that's kind of cool is that subcutaneous fat is an area where they really stay, but another organ that is very much made up of lipids is the brain. And so when you apply them to the scalp, which you're about to find out is one of the thinnest skins on the body. So the thinner the skin, the faster the absorption and the more ease of the absorption, because remember, oils go directly through the skin or they go through hair follicles, and you have a lot of hair follicles on your scalp. And then because your brain is lipid, is made up of a lot of different fat molecules and different types of body tissue, you are going to have a retention of the oils directly in those tissues. So, finishing up our transdermal absorption mechanics, dermally applied oils have effects such as anti-inflammatory effects, etc., on muscle and joints without necessarily having to enter the systemic blood circulation. So let's look at where an oil goes after it enters the skin. Between 1 and 5% of the oils that you apply, the therapeutic chemical constituents will enter the skin through the route that we just described in great detail. Don't worry, the lesson's going to get lighter from here. Many of them are absorbed into muscles, and from there they go into the bloodstream. From there, they are excreted out of the body through the liver and the kidneys. Now, the stratum corneum's layers of keratinized cells really limit the rate of absorption of constituents more than the thin respiratory skin that's in the lungs. And so the only thing I want you to take away from this slide is that the thicker the skin, the slower the absorption. The skin on the inside of your lungs is incredibly permeable. And so just from the information that you have, you should be able to understand that, really, if you're trying to get oils into the bloodstream, that a topical application isn't ideal. If you're wanting to use them for psychological effects, topical application is not your application of choice. When should you use a topical application? Well, if you have a skin issue, like a bug bite or acne, or you want to do a cosmetic treatment, then you should use them topically if you're treating the skin. If you have a muscle condition and you want to not just generally take inflammation out of the body or not just do things generally, but if you really want to specifically put oil over a specific muscle that and you want to treat a muscle or a joint or a nerve in a particular locationalized area, then you would use oils topically. We do teach a topical application in this course of black pepper to the lower back during labor, but there are very few topical applications that we are going to be teaching you. And when we get into the individual oils, we are going to be teaching you strategies of oil application that are specific to that oil and give you all the details based on the molecular weight and bioavailability timelines of each individual oil, how and when and why you should be applying them. So you should be applying oils topically only for those reasons, but it's good for you to know why. And it's because the stratum corneum is really thin in certain places, like the face or the scalp, and it's very thick. In fact, it's the thickest on the palmar skin of the hands and on the bottoms of the feet. So my experience, I have been a massage therapist, feels like in a past life. But many years ago, I used to be a massage therapist. And that experience is really confirmed by research, which is that, the palms of the hand have really such a thick epidermis and obviously no hair follicles, which means that oils will really preferentially be absorbed by the thinner body epidermis of the person being massaged rather than into my hands. And so body locations, just for a quick overview, now that you have this information, you should really be able to tell for yourself about these different areas, but let's just talk about them. The forehead, temples, or the scalp is going to allow for an absorption of oils through those very thin skins. The chest is not an ideal place to put a whole bunch of oils during labor because I just remember not knowing anything about oils and slathering myself in deep blue. I can't believe I'm publicly admitting this right now. And I just remember my infant just recoiling off of my breast, just like could not stand the smell as like a newborn, like within 24 hours of birth. I had put it on my chest during labor and then continued to apply it postpartum. Again, I cannot believe I'm admitting this publicly, because when you don't know, you don't know. And it had menthol in it and all of these, so I'm putting it on my chest because I didn't realize how effective oil use was through inhalation. I didn't understand the information that you're about to get on how amazing and how effective inhalation was. And so when you don't have that information, all of your senses are just like loving these oils and you're just wanting to put them all over your body but you're wanting to smell them. And so the natural place that most people who are untrained in essential oils, where they are going to instinctively put the oils, is probably on their chest because they want to put them on, but they also want to smell them. And so they're going to put them on the upper part of their body. And you really want to discourage a mom from putting essential oils on her chest. And if she does, you want to really make sure that you are cleansing that chest in the method that we recommend to transition an oiled labor space to a newborn safe, fragrant free environment. So, really no oil should be going anywhere on the chest. And I'm not even talking about like the nipples and the breasts, like just even the chest when you put a newborn when in labor and delivery, you don't want to have any oils on the chest because the mom coming out of labor and delivery and having that secure attachment with the breastfeeding, I mean, you want that child to be smelling its mother. You don't want any interference with essential oils to that smell bond that's being imprinted on the child. You want them experiencing the smell of amniotic fluid to be the most prevalent smell that they're smelling. You want them to be feeling the mother's heartbeat, and you want to provide for an amazing, gentle, loving transition. Those few moments after birth that will absolutely affect that child's sense of safety and well-being and their sense of home for the rest of their life. So you absolutely want to encourage the mother not to put oils on her chest. You also want to encourage the mother not to put oils on her abdomen. When you have a pregnancy, you're going to have a compromised skin barrier function on the abdomen. And again, we just don't want to put oils on skin that's been that just has a compromised barrier that's compromised because it can induce an adverse reaction. Lakes aren't a super effective place to put oils either. So unless you're using it specifically for a muscle ache or a joint ache, legs should only really be used for that. The bottoms of the feet have an incredible amount of sweat glands, which is why they stink and why they get wet. You might know about this if you have a husband. And women's, feet tend to sweat less, but your feet are just covered in oil-repelling, water-based skin openings. And so the bottoms of the feet are not only the thickest skin on the body, but they also have the most uh, sweat glands. And so if there was a prize for the least effective place to put an oil, and really the safest place to put an oil because you might be getting close to 0% absorption, you are probably getting like 1% absorption, maybe. It would be the bottom of the feet. So why do MLM companies recommend this method? Well, it's because if you start early beginners off with putting oils on their feet, there is almost a 0% chance that they are going to have an adverse reaction because of skin sensitization. It's just not going to happen. So if you wanted the safest way to introduce oils to to a very large group of people and really be able to stand behind that recommendation as a company and considering liability and whether or not the information that you were telling people were going to injure them, this is what I would do. I would tell people to put oils on the bottom of their feet because if they do sense like, oh, I don't like that, or it's not working well with my body chemistry, you're going to have it's a very gentle introduction. So that's the issue with the bottoms of the feet. The lower back, we're going to teach you some specific applications a little bit later in this course. But let's go ahead and talk about factors that increase absorption. You will recognize all of this information from the course, the therapeutic range of safe and effective oil use in labor and delivery. So this is going to be a quick reminder for you, things that increase the absorption of oils. As we've been talking about the skin thinness, the skin permeability, and the area of the body that the oil is applied to affects the amount that is absorbed into the skin, the muscles, the bloodstream, and then that's excreted out of the body via the liver and the kidneys. If you cover a significant amount of the body with oils, such as with massage, you are going to have increased absorption. The temperature of the skin, which is often elevated in birth, increases absorption, and so does the condition if you have inflammation, compromised barrier function, etc. We already talked about the thickness and permeability of the epidermis, and we talked about how oftentimes there's a journey of experience where more experienced oil using mothers will switch from applying oils to the bottom of their feet to the more permeable areas. Now, one thing that I forgot to mention about feet is that If a mom has an epidural, that is the only time in labor that you would ever approve or not actively try and resist an application of oil to the bottom of a mom's feet. You really want to prevent falling. So only if you are absolutely confident that the mom is not going to be walking at all, you really don't want her to be having oily feet on hard, cold hospital floors or on any floors, um, especially if they're wooden or hard floors, because of the risk of falling. So unless the mom is really, you're sure, not going to get out of the bed, really actively discourage any mother in your care who's kind of doing her own oils, really discourage the use of oils on feet, I would say, if she's planning on getting up. So the temperature of the skin, the more blood flow to the upper layers of the skin, the more oil is going to be picked up by the bloodstream. This is true to a certain extent until the mom is really sweating, then the oils are going to be repelled. And that's essentially what this says, is that absorption is going to increase with skin temperature until the point of sweating, at which it drastically decreases. The heat and humidity of the environment really does affect oil absorption. Hydrated skin is more permeable than dry skin, so oil use in the bath and shower is really affected by the humidity. The condition of the skin affects the absorption rate and the psychological stress level of the user. Women are more at risk than men for adverse reaction because of hormonal and psychological reasons. And then also it could be because women have higher layers of fat on their body than men and subcutaneous fat. And so all of these things go into the absorption of oils. So let's talk about proper topical dilution. And this is done to minimize adverse reaction risks. And Robert Tisserand would say that essential oil dilution is important for two safety reasons. One is to avoid skin reactions such as irritation, sensitization, and phototoxicity. And the second reason is to avoid systemic toxicity, like neurotoxicity, etc. Now, with this program's recommendations, there's no way that you're going to be causing systemic toxicity with the level of oil use that we're teaching in birth. And we're also going to talk about phototoxicity, but these are really the two reasons I just want you to know from an aromatherapist perspective why we dilute oils. Now, a therapeutic range of essential oil use is the dose range of an oil where it is high enough to be effective and low enough to be safe. And you always want to use the lowest dilution that has the most effective results. There are three main classifications of topical oil use. There is neat, diluted, and sensitive. Neat is when you put essential oils on the skin topically without dilution. You would only do this with oils that are considered mild and generally do not induce skin sensitivity. We don't train for this in this program, but just to give you a sense, because I don't want to leave you totally shooting in the dark and completely uneducated. Again, I'm not advocating for this use, I'm just informing you about it. A neat application of essential oils would be things like lavender to a burn, or you could have a neat application of oils like frankincense, melissa, or sandalwood. And so neat just means that it is not diluted in any way. With dilution, an essential oil is diluted with a carrier oil before topical application. And with sensitive, this just means that they are more diluted for use on young, sensitive, old skin. And then there are types of oils that you would always want to increase the level of dilution. So things like peppermint or ginger or black pepper or cinnamon bark or those types of oils you would want to just apply with a little bit more sensitivity. So we already talked about this, that essential oils can be applied dermally neat, undiluted, or diluted in a carrier oil. And one thing that a lot of people aren't clear on is that a carrier oil slows the evaporation of constituents, and it may enhance their penetration into the skin, but a primary reason why you use a carrier oil is because it keeps the therapeutic chemical constituents from absorbing into the air. So it traps them on your skin, but it also traps them on your skin. So it slows the absorption into the air, but it also slows the absorption into your body. And so that's why a lot of oils will cause a sensitivity because they are driving really hard and fast into your tissues, and it just causes an inflammation response. And so the larger molecules of the carrier oil are going to slow that absorption process. This is information that if you go to the downloads in this course, you will find this information, but I just want to give you an idea of normal recommendations for aromatherapists on topical dilution rates. And this is an image from the Robert Tisserand Institute where you can see their recommendation for the different uses. So I also have a download for carrier oils, which was in another course, but I've also placed again here. And let's just refresh this information on how bases influence the absorption of essential oils through the skin, and we're almost done. So just stay with me. I think I have like 3 more slides. So vegetable oils are fixed oils that are not ideal for optimal absorption because essential oil constituents, as you should know by now, are fat soluble. And so when they're in a just lipid loving environment, they tend to stay in that. They're not going to have passive diffusion out of an oil-rich environment. A gel, on the other hand, is really just like a very effective water-based delivery system that promotes movement of the essential oil constituents into the skin, because if the skin surface is more fatty than the gel because it's rich in sebum, again, this is going to mostly be sebum is in the skin, but it's really hair follicles. The oily substance that's produced by your hair follicles to keep it moist and seal in moisture, the essential oils are going to be attracted to that oily medium in your skin surface, and they are going to be driven out of the gel and into the skin. Now, a lot of people think aloe vera when they think of gels, but aloe vera gel is actually a very thin, watery substance, and a better option is aloe vera jelly, spelled with a J. That contains added gelling agents to give it that thicker consistency. So I would really recommend a gel carrier for oils if you are wanting to get oils into the skin and into the muscles that you're trying to treat. So lotions and creams then are another option. They contain both water and oil and are held together by an emulsifier. And this is somewhere in between, as you would make sense just scientifically with what you know now. You would be able to discern that an oil is going to slow absorption, a gel is going to drive the oils into the skin as a water-based delivery system, and lotions and creams are probably going to do something in between. Let's look at the difference of how these delivery systems affect the absorption rates of a 5% dilution oil application that was put on the inner forearm with different carriers. You had a 11.3 reading of the amount of oils that entered the bloodstream with the oil. You had 57.3 with the lotion, and you had 238.5 with a gel. Now, after about 4 hours, these numbers really leveled out, and so this reading was taken 60 minutes after the application. So as time goes on, the levels kind of stabilize out. But as you can see here, just in terms of swiftness of getting the chemical constituents into the body, you have a faster delivery system with the gel or with jelly based on oil and lotion. I want to educate you really quickly about phototoxicity because I have burned myself so badly with this that I literally had scabs all over my face. So it's important to me that you learn this information. Quickly here at the end, photosensitization is a process in which ultraviolet radiation combines with just different substances and it causes a chemical and biological change. Some essential oils can contain a constituent, as you can see them listed here, that causes a photosensitization of the skin. And what happens is that the chemical structure of these molecules enables them to form cross-links with the skin cellular DNA that makes the skin susceptible to UV radiation. And so I've listed here for you several essential oils that can become phototoxic or photosensitive. And you can see them listed there. There are several blends that also have these in them, so make sure you know what those are. And basically what you need to know about this is that you never would want to put on these essential oils before going out in the sun or more realistically just a tanning bed, and that reactions can occur up to 2 days after phototoxic oils are applied to the skin and exposed to UV light. So you don't want, so what I did is I actually did a really intensive face mask at an improper dilution with lemon, and then I took my kids to the pool, and then I had sores break out all over my face, and it took almost a month and a half for me to look, for people not to be like, oh my gosh, what happened to your face? You could still see it for up to 2 months, but just to give you a sense that you really want to be careful with these oils as they are they have phototoxicity. Now let's get to the last slide. So I have this essential oil dilution worksheet that I created for you myself, and I have uploaded a PDF where you can practice drawing in these numbers. And I would really like for you not to skip over this. This is a homework assignment, and you need to know with the different bottles what percent dilution, if you fill up the entire bottle with a carrier oil or gel, what percentage, how many drops of essential oils you would need to put in order to get that dilution rate. And it's important for me that you gain a familiarity and a mastery of this, just so that you have a experience-based understanding of dilution rates with essential oils, so that if you're looking at a bottle and you know that you want to have a 1% or a 2%, you know just through experience intuitively how many drops of oil about is going to get you that mix, so that when you're on the go and you're on the fly and you're working with oils and you're in situations that you're not having to look up this information or think about this information. So what I would really like for you to do is to look at these numbers over and over again, and then actually practice with pouring the oils. And then I've prepared this worksheet for you where the number of drops in the worksheet are actually missing, so that you can memorize this and then fill out the sheet with these numbers. But really the goal of mastery isn't that you'll be able to fill in the teardrops, it's so that you will be able to have an intuitive based ability to understand how dilution works and what those ratios are, so that you can make these as needed without having to constantly reference information. So was that incredibly helpful? Did that not just shift your entire understanding of a topical application of oils? I know for me it did. And I shared with you really my worst horror stories of how I affected my newborns and how I've affected my face with an improper topical oil application. So it just gives me really great joy to know that there's a whole bunch of people who will now learn from these experiences and who will know better and do better. And one of the most significant Bible verses that's really affected my life is Romans 12. It says, "Do not be overcome by evil, but overcome evil with good." And I think that when everyone on the planet gets to the point where every single negative experience they have isn't something that gets stuck and retained in their body, and they get stuck on it and repeat it and share the story and constantly bring other people into that negativity, where we don't interact with our pain in that way, but where we're not overcome by evil, but where we overcome evil with good, where we take every negative experience and we say, you know what, I had I caused this this really bad situation for my own newborn, but I'm going to turn that around and cause so much good to come in the world. I'm going to train all these people to make sure that they don't make the same mistakes that I do, and the good that comes out of these painful experiences, it's going to be so overwhelmingly more significant than the pain in my life, then I think we really are going to start living in an entirely new human experience where we are something that the Bible calls we are more than overcomers. It's not just that. It's like, well, everything kind of balances out. It's like, no, there's actually nothing that you can do to me to bring me into negativity or darkness, because anytime you do that, I overcome that evil with good and I cause an infinitely more significant force for good in my life than the evil. And that's really where you start to overcome by the power of your testimony. And so I want to encourage you to take this information, to internalize it, to serve well, and to be a part of a new generation of people who know how to work with essential oils, plant-based medicine, so that the next generation is able to have a level of well-being and connection that is at a level where we've never seen that in our human experience before. So thank you for sticking with me. This was a little bit of a long lesson, but this information has completely changed the way that I work with plant-based medicine, and I want to thank you for being a vessel and a carrier for this information so that you can go and be a part of my testimony of good things going into the world with essential oils. So thank you so much for your attention, and I'll see you in the next class. See you soon.